Hello, everybody, and thank you for joining us today. My name is Amber Garcia, and I'm the Executive Director here at Women's Voices for the Earth. We also say our name is WEAVE. Our organization has been working in the environmental health field for about 25 years. We're actually celebrating our 25th anniversary this year. And so we work on safe cleaning campaigns for nearly 15 years, addressing health concerns associated with exposure to toxic chemicals in things like cleaning products, including disinfectants, fragrance chemicals, allergens, and other chemicals found in cleaning products that have been linked to things like reproductive harm, cancers, and respiratory issues. We also work to provide specific guidance to cleaning product companies on chemical screening and safety. So as we navigate this public health crisis, we will continue to provide resources, information, and ways to take action, even from your homes, as we recognize that a lot of folks are practicing social distancing and or sheltering in place for some of us in different states. So I'm actually going to turn it over now to our Director of Science and Research, Alex Scranton, who's been with the organization for just about 20 years, and will lead us through this discussion and then leave some time at the end for some Q&A.
Okay, thank you so much, Amber, and thanks everyone, and welcome to the webinar, and we're really thrilled at the turnout of everyone who's joined us today, and hope you find the information useful. The coronavirus pandemic that we're finding ourselves in has brought increased attention both to disinfectants and disinfecting practices recently. But we really feel that the discussion around the potential toxicity and health harms of those disinfectants are only rarely being discussed. We really hope with this webinar to provide some helpful information and some fresh perspectives around disinfection, particularly in the home. I want to make a few disclaimers. My first disclaimer before I start is that I don't claim to have all the answers. This is a really complex situation. It changes by the minute. So I expect there will definitely be questions I can't answer in some cases because there are no answers yet. But we at Women's Voices for the Earth remain committed to continuing work on this topic, and we'll be updating information when it becomes available. I also want to be clear that this webinar really focuses on cleaning and disinfecting in your home. There are certainly different issues and considerations for public spaces, for hospitals, for food service establishments, nursing homes, et cetera. I can touch on how those considerations are different from the home, but they won't be my focus today. And they're really not my area of expertise. And you can't really make generalizations across venues like that. So let's get started. My first slide. So this talk is really going to be covering three main themes or general pieces of advice for folks looking to better protect their health. The first piece of advice is to prioritize the most effective strategies for reducing the spread of the virus. This is something we need to do today as a society, and something we need to do each individually for our own health as well. The second piece of advice is to keep your surroundings generally clean. I'm going to talk a lot about the benefits of cleanliness and hygiene for your health. And the third, and possibly a distant third, is to choose safer disinfectants where possible. And I'll discuss what we know about that so far. And that's an ever-evolving landscape. So let's start with number one, which is prioritize the most effective strategies for reducing the spread of the virus. As you've no doubt heard ad nauseum, washing your hands and practicing social distancing are the most effective ways to protect your health. As the Centers for Disease Control has stated, and certainly as we understand it, people are getting this virus from contact with other people who already have it, from that close contact person to person. So why are we telling people, why hand washing, right? This is simply because hand washing works. I'm a total data geek. I like to see the science behind claims. And for hand washing, there's some pretty good science to support its efficacy. There are really good studies out there comparing classrooms, for example. You'll have one classroom where they've established specific hand washing protocols and education, and the teachers are making sure the students are doing it. And then you'll have another classroom where they're letting the students, do what they would normally do. And then they measure the levels of illness and absenteeism of the students between the two classrooms, and you find that they're significantly different. More hand washing equals less illness in numerous studies in numerous settings. Not all studies have turned out this way, and granted, it's a tricky thing to measure. We do know that people will lie about their hand washing frequency, but there is some really good data there showing that washing your hands can really affect your health. Secondly, social distancing. It also works. There's some great data that's really been revived recently and been studied recently from the 1918 influenza epidemic. There are more recent studies from the 2009 H1N1 flu pandemic where the health benefits of social distancing can be seen. There are certainly clear harms of not distancing that have also been demonstrated. So again, there's some great data to back this up as a truly protective strategy. So you've heard it before, and you will likely hear it again, but wash your hands and stay home as much as you can. Let's see. So the second piece of advice is keeping your surroundings generally clean. Cleaning and general hygiene are great for your health, right? Cleaning, there are numerous benefits to being more dust-free in your home, having better indoor air quality, having cleaner surfaces. There are certainly mental health benefits from living in a cleaner space. The physical activity of cleaning can be very aerobic and can be good for you as well. And I could go on. There are numerous benefits. When it comes to surfaces, soap and water, just or regular non-antibacterial detergents, not to mention a little elbow grease and a good cloth, are amazingly effective at removing both dirt and germs from surfaces. Grime and dirt on surfaces is where germs like to hang out and thrive, right? So generally cleaning them off makes them a lot less attractive to the organisms you don't want around. And this is why you see instructions for disinfectants, including the recommendation to specifically clean a surface first before disinfecting to get the best efficacy. But the big question really remains, do we actually need to disinfect in addition to regular cleaning in our homes to protect our health? And given the data geek that I am, I have to look at the science and what it tells us. Now, we know these three things from available research. We know, one, a person with a virus can shed viruses onto surfaces, right? If you have a virus like the coronavirus, you can touch something, you can leave virus particles behind, and they can be measured. The coronavirus, we know, can remain infectious on certain surfaces for hours to days, and it depends on the type of surface. So if you leave it behind, it doesn't die off immediately, but it can, in fact, be there and be infectious. And then the third piece of information that we know is that a person can contaminate their hands by touching contaminated surfaces. Their hands were originally clean. And studies have measured this, where they've inoculated surfaces with various organisms, had people touch them, and then measured how much ended up on their hands. So it's a very logical theory of transmission from one person to another through a surface. But there is really a scientific question of whether or not that kind of exposure is actually enough to get you sick. And the Centers for Disease Control is also clear on this, and they've noted that transmission of novel coronavirus to persons from surfaces contaminated with the virus has not been documented. Certainly, they've documented transmission person to person, but just from someone touching a surface that's been contaminated, they have not seen that happen yet. And let's also see what the research says about other types of illnesses. Now, there aren't controlled studies yet on COVID-19. There certainly hasn't been time. There are all kinds of ethical considerations with doing this kind of study right now. But we can look at studies that are measuring other kinds of illness. And the research is kind of scant, but truly studies in households of healthy people have never found that disinfecting at home does more to reduce illness than regular cleaning with soap and water. One of the best studies showed, in fact, the opposite. It was a study done in New York. It was a randomized, double-blind study of over 200 families that were followed for a whole year, and they tracked every instance of illness in these families. Now, half the families were given disinfectant antibacterial cleaners to clean with for the year. The other half were given just plain detergents, soaps, soap and water to clean with. And they measured the level of illness. Both groups of families had equal levels of illness over the year. There was simply no difference. The fact that one family was disinfecting and one was not made no difference to the number of colds or stomach flus or coughs or et cetera that they experienced throughout the year. So as I often remind people, you're not doing open heart surgery in your kitchen, right? Extreme disinfection in a hospital, in an operating room is absolutely critical and crucial for health. If you're opening someone up, they're vastly increasing their chances of infection. You're in a building full of sick people with a wide diversity of germs. You can be handled by medical professionals who have spent all day in close contact with other sick people. The risks are enormous. Disinfection is very important, and it really works quite well in those situations. But in your home, you're not doing these kind of invasive procedures. You're not surrounded by that diversity of sick people. And maybe even more importantly, after you disinfect your kitchen, your family is not re-entering wearing clean scrubs and gloves and masks, right? They're coming in, they're touching everything with their grubby hands, possibly reversing many of your disinfecting efforts in quite short order. Now I want to be clear before anyone misunderstands me. Am I saying that disinfecting is pointless and we shouldn't do it? No, of course not. There can certainly be a time and place for intentional disinfecting in the home, absolutely. But it shouldn't be the priority strategy for disease prevention. And it should be done with caution because many disinfectants are truly potent pesticides with unfortunate side effects. With all due respect to our colleagues or good friends at RB, right, you can't Lysol your way out of a pandemic, right? It's just not an effective enough strategy on its own. And personally, I believe there's a lot of misleading marketing that's convinced us to put much more faith in disinfecting than it merits. Now, I want to make the caveat that disinfection can be a more important tool where there are people with compromised immune systems or other vulnerabilities in a home. Certainly if there's a person who already has the virus in the home. Similar to a hospital or nursing home setting is different. These factors can change the risk profile in a home significantly, and certainly more extensive disinfecting is commonly recommended by health professionals in those situations and should be followed. But truly, there's no data to support it. I've never seen a study that measures the effectiveness of disinfecting in a home with vulnerable populations. We really don't know how well it works in these situations either, but it tends to be something that's considered more worth the risks to do it that way. Let's see. So lack of sort of science aside, we also understand that it is totally understandable and really quite human to want to disinfect your house more during these days, during this epidemic. As you've all no doubt experienced in your grocery stores, the disinfecting products are all sold out, right? This is something that people are eager to do and have been doing. So what do? Our recommendation is if you choose to disinfect in your home is to choose safer disinfectants where possible. By far, the most popular and available store-bought disinfectants largely contain one of two active ingredients. They either contain quaternary ammonium compounds, or quats, or chlorine bleach, or sodium hypochlorite. Both are extremely potent chemicals, and both can pose health hazards. They do kill germs, but they've got these hazards. And so there's a real question of whether or not the trade-off is worth it. And I want to get into some of the details of the hazards. So I'll start with quaternary ammonium compounds. Quats are potent skin irritants. They can cause rashes and dermatitis, and particularly on your hands when you're cleaning. Maybe not the worst outcome in the world, but if you clean for a living, it can become quite a significant quality of life issue. Quats can also irritate your lungs, leading to breathing problems. In fact, it's well documented that cleaning workers exposed regularly to quats have developed occupational asthma on the job. And there are a lot of concerns about instances of occupational asthma increasing these days as cleaning workers have greater exposures to quats on the job. Quats are also linked to reproductive harm. Now, this research thus far is only in mice. It is emerging research. affecting the fertility and leading to birth defects in mice. We don't know if these effects are happening in humans, but certainly there's a lot of unexplained infertility and unexplained birth defects in the world, and no one is asking these parents what they're cleaning with. So we simply don't know, and it's really a potential concern given the widespread exposure. And then lastly, and this is the one that's probably keeping me up at night most recently, especially in preparing for this webinar, the widespread use of clots is contributing to the global problem of antimicrobial resistance, leading to the development of superbugs that cannot be controlled with antibiotics. This is best documented in the livestock and meat industry right now, where clots are commonly used to disinfect animal holding areas and processing centers. And researchers are routinely finding clot-resistant bacteria. These are bacteria like E. coli, Staph aureus, Listeria, bacteria that cause disease in humans. And what's found is that these bacteria become resistant to clots, and simultaneously they're found to be cross-resistant to a number of important antibiotics used in humans. So this is a real problem. And the last thing we need is for people attempting to keep themselves safe from coronavirus who are in the process creating antibiotic-resistant E. coli or something like that in their homes. So that was clots. Let me talk a little bit about chlorine bleach, which is the other popular active ingredient that you'll find. It's both a significant lung irritant and eye irritant. Prolonged exposure, particularly to concentrated bleach, can cause chemical skin burns, which are pretty unpleasant for sure. Bleach is the leading cause of chemical eye injuries in kids in the U.S. for the category of cleaning products. This largely happens with spray bottles of bleach solutions. If you spray them in the eye, these kids are going to the emergency room because of their injuries. And by far, chlorine bleach is the leading cause of calls to poison control for that category of cleaning products. And it results in the greatest number of moderate to severe health outcomes for any cleaning product. Second and third place go to drain cleaners and oven cleaners, but bleach is by far out front in the number of calls. As you know, an awful lot of bleach has been sold in the last 2 weeks. It's in a tremendous number of homes. I think it's very likely we will see these kind of adverse effects go up in the weeks to come. These are largely due to accidents happening in the home, largely involving children, as people are more eagerly reaching for bleach in an attempt to protect their health. And now, perhaps a slide that many of you have been waiting for on this webinar. What do we know about safer alternatives? The good news here is that clots and bleach are not the only active ingredients that work. They tend to be the most popular active ingredients in products you can buy, but it's not a matter of using them or nothing. Safer options do exist. The two most commonly available and popular options are hydrogen peroxide and alcohol, either isopropyl alcohol or ethanol. And you can use those either straight, you can get those individually kind of at the drugstore, or there are cleaners containing these two alternatives. There are also cleaners containing lactic acid and peroxyacetic acid that are also safer. A caveat on those, it's a lot more difficult to get, a straight bottle of lactic acid or peroxyacetic acid, and I wouldn't recommend it. In their more concentrated forms, they can be quite corrosive, and we want to avoid using those. But if you're having a cleaner that contains them, they'll be much more diluted to safer levels. So don't try those at home unless you're doing a pre-diluted cleaner. But hydrogen peroxide and isopropyl alcohol you can get at the drugstore whenever those drugstores are restocked, and they're readily usable. I thought about leaving an open option of others on this slide. This list is not an exhaustive list. These 4 chemicals are all active ingredients found in products on the EPA's new list of products expected to be effective against the coronavirus. You can find that list by Googling EPA List N, that's N as in Nancy. To be clear, this EPA list is limited to products that are already registered as pesticides by the Environmental Protection Agency. They are products that are put forward for vetting by the manufacturers themselves, so they have to be suggested by the manufacturers to get on the list. And given that the coronavirus is an emerging pathogen, there's no actual data on the effectiveness of these products specifically against COVID-19. Some products have been tested against other coronaviruses, perhaps like SARS. Some have merely been tested against other viruses that are expected to be harder to kill than COVID-19. This list is really kind of a best guess at effective products. So just because a product is not on the list, it doesn't mean that it's not effective, because it may not have been suggested by the manufacturer, or not yet. The list is ever growing. And unfortunately, if a product is on there, it's also not a complete guarantee that it's effective. We could be guessing wrong, and there's a lot that we still need to learn about this coronavirus. And there are a bunch of other disinfecting technologies. There are things like microfiber cloths, steam cleaners, ultraviolet disinfection. These are kind of things that will probably never be added to this list because they're not technically pesticides under EPA purview. Unfortunately, we don't have an official authority that can vet these technologies currently, but it's something that we do as a society need to work on. These could be great, safer technologies and safer alternatives, but we don't have the data yet to know how they work. I think there will be a lot of people working on this and getting results published so we will know more about the efficacy of these technologies. I think a pandemic is pretty motivating for research like this. So stay tuned. Women's Voices of the Earth will be tracking those and seeing what information is becoming available. So why do we need to look to these safer alternatives? And maybe I'm just reiterating myself here, but we have to remember that nothing is going to be perfect. Substances that are designed to kill things like viruses are often inherently harmful. So we have to be really careful with them. But right now what we need is to broaden the availability and usage and diversity of safer disinfectant alternatives because we know that people are disinfecting more than they used to in their homes. Businesses and public places, the ones that aren't already closed, they are also disinfecting more than they used to. Which is really increasing exposure, particularly to those people who are doing the disinfecting. We're particularly concerned about seeing more dermatitis, more asthma, more eye damage, and potentially more reproductive harm in cleaning workers as a result of their greater exposure to disinfectants in the recent times. And this situation also looks like it's going to last for a while. This era of increasing disinfecting, it certainly is going to last weeks. It will likely last months and possibly years. So we're talking about chronic exposure, long-term chronic exposure, which is different from kind of a one-time blasting your house with disinfectants after you've had the stomach flu, right? That can be a one-time exposure, but we're talking about exposure that's day after day for quite a long time. And then lastly, we'd need to prevent a potential secondary epidemic of multi-drug resistant bacteria that could be caused by the overuse of some disinfectants like cloths. This is not something we need to add to our already stressed healthcare system. So where can you find these safer alternatives? Unfortunately, they're not currently easy to find them, right? The shelves are empty, and some of them are harder to find than others anyway. There are certainly major manufacturers producing cleaners with hydrogen peroxide and lactic acid, for example, but they don't have the shelf space usually of the more popular cloth-based, say, Lysol or Clorox disinfectant wipes. We need to be asking manufacturers to produce the safer alternatives and to produce more of them and make them more available. What can you do in the meantime if you don't have any disinfectants in your home because you can't get them, which is a reality for a lot of people? We have to go back to my first two pieces of advice, right? We want to prioritize the most effective strategies for reducing the spread of the virus, washing your hands, and practicing social distancing. This is by far going to give you the biggest bang for your buck. And then secondly, keeping your surroundings generally clean with soap and water, with regular detergents, something you can control with stuff you already have around, you can still get in some stores. This is going to go a long way towards protecting your health. And then together, we really need to demand safer alternatives from manufacturers of cleaning products and of other technologies, other kinds of disinfecting technologies. We need to get that production ramped up for those safer alternatives. So this is my near last slide. I just want to let you know some of the additional resources we have on our website. I encourage you to check out our Quit the Clots page, which we've been running for quite a while now. We've got a bunch of helpful fact sheets on clots that you can share, some that we have authored, some that are from various state health agencies who've published some great information on the hazards of clots. We also have a blog that we are just about to publish. It's coming out very shortly, and it's called Safer Disinfecting at Home in the Times of Coronavirus. This blog will largely go over what I've just gone over in this webinar, if you, like me, are one of those people who want to see all the studies and you ask, sort of, show me the science, the blog will have citations to all the studies that I have referenced. So you can see those and link to the actual studies, which is helpful for those people who want to see the science, which I totally understand. And then lastly, there's a link and invitation to our PAC group. This is a group called Parents Against Clots, and this is a national action group of concerned caregivers who are taking action to eliminate or reduce children's exposure to clots in schools and child care facilities. So you can join that group if this is something that you're interested in pursuing. All of the links will be sent out to everyone who registered for this webinar first thing next week, and along with a recording of the webinar, which you can share with others. So now we've got some time for questions, which is great, and it looks like we've got a lot of great questions in the scroll, so I appreciate that. So let's see. Okay, so one of our first questions is, how do you deal with cleaning incoming groceries that are delivered? This is certainly an issue that has been coming up. There's a lot of recommendations for people who have stay-at-home orders, for people who are not leaving their homes for good reason, are getting grocery deliveries, and what do you do when those groceries arrive? The risks of coronavirus on groceries are relatively small, I think, but nobody really knows, right? Nobody really knows. There certainly hasn't been a documented case of anyone getting coronavirus from groceries. The good news is that the virus does not last very long on cardboard, and likely not also on paper. So those products are less likely to have active infectious virus on it. Might last longer on plastic and metal. I think a simple solution, obviously depending on what the groceries are, some groceries obviously need to be brought inside and put in the fridge. If you can wipe those down, that's going to be your best bet. And if there are other groceries that can either sit out for a while before you handle them, time alone will help significantly reduce any virus that might remain on them. Also importantly is, once you're handling these groceries that have been handled by other people, is to wash your hands immediately afterwards, after putting them away, and maybe sort of, see if you can not use them for a day or two, will also limit your exposure. I don't think anyone has perfect science on this, but I think the risks are relatively low, but there are some precautions you can take in terms of cleaning, just wiping them down before using them, and certainly washing your hands immediately after handling them. We've got another question asking about the strength of hydrogen peroxide that would be needed, and what about vinegar? Two really good questions. Hydrogen peroxide generally that you see in kind of your average drugstore is at a 3% level, and that has been shown to be effective on other kinds of coronavirus. So 3% is just fine. I was looking at some of the cleaners on the EPA list N, and they have levels anywhere from 1% to 5%. So that 3%, is kind of right in the middle and is considered effective from what we know. Vinegar is another story. There aren't any products on list N that have acetic acid, which is what vinegar is, as an active ingredient. Vinegar is very good at deactivating bacteria. There's a lot of studies on vinegar's effect on bacteria. There's less evidence of it being effective on viruses, and certainly no tests that I've seen specifically on coronavirus. So maybe less effective on viruses. It is a great cleaner though. So from my earlier recommendations about generally cleaning your home. Vinegar is going to do a great job at getting rid of the dirt, getting rid of the grime where viruses and bacteria will hang out on your surfaces. So it's still certainly a very effective cleaner for that purpose. But if you're specifically looking at trying to deactivate coronavirus, it may not be the best choice. We just don't know. So similar question is asking about thyme essential oil or other antiviral essential oils. There certainly are some essential oils that have been known to have bacterial efficacy, some that have some antiviral properties. Again, none of these are on that list N from the Environmental Protection Agency. At least they're not yet on that list. And so we'll be following that as we know. I think we need more research on essential oils. Certainly there's a impression that just because it's an essential oil and it comes from a natural plant that it can't be harmful, and that's not necessarily true. There's lots of things that come from the natural world that it can actually be quite dangerous. So it's not a given that it's a safer alternative. I think we need some, certainly in their most concentrated form especially. I think we need more research on those, and hopefully that will be coming, because they could be good, safer alternatives. I just don't think that the data is in quite yet on thymol or other essential oils. Here's a good one. I have some hand sanitizers I bought a few years ago. The expiration is March 2020. Are they still effective? I would say yes, especially given that hand sanitizer is very hard to come by. By all means, with the expiration of March 2020, very unlikely that they would not be effective even for quite a while. Largely the active ingredient is ethanol. That lasts kind of forever. Unless you can see, well, no, I can't even imagine that anything would be growing in it because it's full of alcohol. So yes, I would say absolutely that's going to be fine to continue using. This is another tricky one about hand sanitizer. We've been hearing from our friends in rural Alaska that there's no isopropyl alcohol available. Is there an alternative for hand sanitizers for people who may not have as much access to washing hands frequently? And this is a really tricky one. There are non-alcohol hand sanitizers that we don't recommend, mostly because the active ingredient are quartz. But I haven't seen anything else that people talk about using as an alternative to isopropyl alcohol if you were kind of making your own hand sanitizer. It's a really tough thing. As soon as you can get to washing your hands is going to be your best bet, and planning for that as much as possible. It's a really tricky thing. Hopefully the stocks of things like isopropyl alcohol will be restocked soon, and so you got to do the best you can, until you have those. Okay, I had a question about, do you literally mean cleaning with soap, or do you mean cleaning with a detergent solution? And yes, I do mean cleaning with detergent or soap, anything that's not antibacterial cleaner, not a disinfecting cleaner. Anything you normally clean your surfaces with, just to get them clean. That's what I mean by cleaning with soap. So thank you for that clarification. Let's see. Okay, so here's a question. If soap and water kills the bacteria, what is the theoretical benefit of then disinfecting? And is the idea that you're likely to miss some of the virus when you wash? Is the disinfection might kill those survivors? If so, wouldn't washing twice do just as well? Is the idea that it's easier, more effective to wipe surfaces like door handles than to wash with soap and water? It's a bunch of questions here, but they're making some really good points. It's hard to say. There's actually some great articles out and we will link to them in the blog, about how soap and water can kill viruses, particularly coronavirus, and how it kind of gets in there and breaks open the cell membrane, which is pretty cool and pretty amazing. There are recommendations to continue disinfecting, particularly if you have someone vulnerable in your home. Washing twice is certainly going to do a lot. It's really hard to say what the theory is about disinfecting on top of washing. We really don't know what the additional benefit is. There can be additional benefits in those very high risk situations where you really don't want to take any chances. It's more difficult to say on surfaces that are likely to get recontaminated fairly quickly when your family is touching them again. There is recommendations to touch surfaces like door handles and frequently touched areas, or to disinfect those more frequently. Where that is coming from is that there are studies where they've gone around looking at what surfaces in a house or in a business have both the greatest number and the greatest concentration of bacteria and viruses and things. And you can measure those by swiping the different areas. And they do find very logically things like door handles, elevator buttons, faucet handles, things like that, things that you're touching frequently with your hands, right? Because this is how we know that you can get things from your hands and you can put them on surfaces. And if a lot of people are touching those things, then they can get contaminated. So the theory is if we were killing the bacteria on those frequently touched areas, we're going to be protecting health. We don't know if this works, quite honestly, the problem being that they are frequently touched. So it may only last kind of for the next person who touches it, and it's pretty difficult to, wipe down frequently touched surfaces every time you use them. It's not particularly practical. The better option for sure is washing your hands, right? So if you're getting anything from any of these surfaces, you can wash them off quickly, and that's going to be the more effective way to go. But it's a really good question, and I think there's a lot of questions about how effective that strategy is. But if you are going to be disinfecting, then certainly if you want to reduce your exposure, just disinfecting the most frequently touched surfaces rather than the ones that you're never touching is certainly also a way to reduce exposure. That's very prudent. Here's a question about addressing the efficacy of products that are sold with antibacterial additives. So not just soaps, but also things like cutting boards or carpets or countertops that are sold as antibacterial surfaces. And so what do we think about those and what they might be doing? This is a very good point. The data don't show that these have particularly meaningful protection. A lot of them have different agents kind of embedded in the plastic that have been kind of shown in some lab tests to kill bacteria, but not really effectively if they are severely contaminated, like a cutting board. If you're going to put raw meat on it, it's just not going to work. And the problem is it could give a false sense of security, which might lead to less cleaning, right? And you're like, oh, I don't have to worry about it. It's already an antibacterial surface. I've already got an antibacterial countertop. You do have to clean these things off because they're not going to be that effective. And certainly the antibacterial surfaces could also be contributing to the overall antibiotic resistance. So certainly not recommended, just as we don't recommend antibacterial soaps in your home. They're no more, not more needed than regular soap and water for washing your hands. I think we can handle a couple more questions. This is from someone who saw a recipe for disinfectant online involving isopropyl alcohol with a small amount of hydrogen peroxide and essential oils. And is it safe to mix alcohol and hydrogen peroxide? I have not seen this recipe online before. Generally, I would recommend not mixing chemicals like this. There are some very interesting and occasionally dangerous things that can happen when you mix ingredients, particularly ones that have disinfecting properties. I don't know what the chemistry is if you mix alcohol and hydrogen peroxide, but I wouldn't recommend it just as as a standard recommendation. If you have alcohol, if you have hydrogen peroxide, that's great that you have both. I would use them separately because they're both going to be effective, and it wouldn't be necessary to combine them. Certainly mixing certain chemicals together can lead to very dangerous situations. So we certainly don't recommend that sort of mixing unless you're just mixing with water, right? Here's one about, do you happen to know or know of OSHA having cleaning guidelines for employers to follow before remote employees return to workplaces? I have not seen this, and I don't know that it's something that they will necessarily do. The advantage with our current situation is that most employers that have shut down and have employees working remotely have had empty buildings for quite some time, right? And if they're empty buildings for long enough, then they're with nobody in them, then your risk of coronavirus is extremely low because it's just not going to last that long on the surfaces in that office. So just having that time should really take care of it. It may be different if you specifically have closed because you've had employees that had the virus, in which case there's a greater risk. But I haven't seen OSHA cleaning guidelines, and maybe it's something that they will come out with. But I think a lot of places, had their employees go remote and then did, some cleaning on top of that and disinfecting, and then with sitting empty, for a week or two. That should really take care of it. It should be fine when employees return, whenever that might be. And this is a tricky question. If you had to choose between cloths and bleach, what would you choose, for example, if you had a sick family member? This is a realistic question. I wish we didn't have to choose between those two. They are the most, popular items if you've already done your shopping and you managed to get disinfectants and you are now under stay at home. That might be what you have in your home. Probably I would choose bleach. It's really, a tough call, but you just have to, either way, you just have to be really, really careful when you use them. Wash your hands afterwards. Be really careful as you're diluting bleach so that it doesn't splash. If you have a sick family member, you have to use what you have available to you. And hopefully, as time goes by, we will have safer alternatives to use, so it'll only be a shorter exposure, to cloths or bleach, because they will be effective at disinfecting. But it's a pretty close call between the two, and hopefully there are better and safer alternatives more available soon. And maybe that's our last question. Yeah, I think that will be our last question with our time is up. So thank you so much. Thank you. These are great questions. We'll be incorporating these into some future blogs as well. There's lots of ideas of what people want to know, and we're happy to answer questions as the answers become available.